One of the most prominent health issues in our world today is heart disease. One type of heart disease is congenital heart disease, which is a heart defect from birth. Hello, I'm Anne Marie, and I'm here to tell you about congenital heart disease. The heart was made in a certain way with valves, arteries, and chambers connected to allow blood to flow correctly throughout the body. However, what happens if these structures are formed incorrectly before birth? The answer is that a heart defect occurs. According to the CDC, about 1% of births per year in the United States have at least one heart defect. These defects can range from a narrowing of certain valves to even entire holes in the heart. For example, the most common type of heart defect is a ventricular septal defect, or a VSD, where there is a hole in the wall separating the two lower chambers of the heart, the left and right ventricle. Now, how is this problem of congenital heart disease solved? There are, of course, surgical solutions, but these can be expensive and risky at times. However, with modern technology, there have been found new non-surgical ways to address heart defects. One doctor in particular, Dr. Michael Angtuaco, specializes in this area of study as a pediatric cardiologist. To learn about his field of study and these non-surgical interventions, I filmed an interview with him, and these are the results. All right.
Hi.
Hello. Introduce yourself and what exactly would you say you do in the cardiovascular world?
Sure. My name is Dr. Michael Angtuaco. I'm an interventional pediatric cardiologist, and I am the medical director of the cath lab at Children's Hospital.
Why did you choose your position as a pediatric cardiologist, and what do you think is unique and interesting about it?
Well, the medical field is a process of slowly whittling down what it is that fits you the best.
Yes.
And I enjoy taking care of kids, but I also like problem solving. Not that pediatrics is not problem solving, but I think that pediatric cardiology uses a lot of logic to kind of sleuth out what specific type of heart diseases each kid have, because they're all very unique types of heart disease.
How exactly did you get to this position, or what kind of education or training did you have to do to become?
Yeah, so I did my education all over the place. I did my undergraduate at Notre Dame, where I majored in pre-med and philosophy. Philosophy is kind of where I got my start in problem solving. And then I did 4 years of medical school at UAMS, and then I was at Emory for 3 years doing my pediatrics training. And then I came back here for 3 years to learn how to be a cardiologist, and then an additional year of training up in Denver to get the intervention piece where I can work in the cath lab. So those are the different steps I took education-wise to get here.
All right. What do you think is the most valuable thing you learned during your training?
The most valuable thing that I learned during my training?
Yes.
Well, one thing that I really liked about my specific job role when I first encountered it, when I was a baby cardiologist, when I was learning this as a fellow during my very first rotation, was I liked being able to fix things in the heart, and I liked being able to see how we use technology to move past just fixing things with surgery to now being able to fix things without surgery. And I think that being able to be creative about the tools we have and to be able to apply them to different situations has been one of the more interesting parts of my job that I've had to learn about.
How does your day-to-day flow go out, and what do you do every day?
Yeah, so most days I'm working in the cath lab doing procedures, interventional procedures on babies, kids, even some adults with congenital heart disease. And so I'll get up in the morning and get to the hospital right around 7 o'clock and go and see my first patient who's going to have a procedure that day in the pre-op area. Talk to them and their family about what we're planning on doing, talk to them about the risks of the procedure, answer any questions they have, and then I'll do 1 or 2 cases, sometimes 3 cases in a day, where I will do a cath procedure, which is an invasive procedure that's not quite surgery, but it's kind of like surgery, and that they have to go to sleep, they have to be under anesthesia, and then we put catheters inside of their leg to get up inside of their heart to measure pressures, and then typically fix something inside of their heart also. And so That's what I do most days. I also have days when I'm in a clinic and I'm seeing patients who have had something done to their heart or may have something done to their heart at some point in the future. Those are my two main job roles that I'll do.
Like a checkup?
Yeah, like as a checkup, yeah.
Okay. All right. What are some conditions or heart defects of people that you see?
Oh, golly. So one of the interesting
Or like
things...
the most common. You
Yeah.
can just say the most common.
Well, yes, we can talk about some of the most common things. But actually, one of the most interesting parts about what I do and why I like what I do is that there's so much variety. There are dozens and dozens of ways that the heart can go wrong when it's forming. And so one of the more interesting types of heart disease that I treat is called tetralogy of Fallot, which is one of the blue baby heart defects.
Yes.
The heart is formed in such a way that the lungs aren't getting enough blood flow and some blue blood escapes out into the body. And so there's a series of interventions we have to do. We have to fix it when they're a baby, and then that fix involves oftentimes messing up the valve that controls blood going into the lungs. And so those patients follow up with us forever, even into their old grandma and grandpa age. And typically, periodically, you'd have that valve replaced. So that's one of the things that we do. I also treat things like that are simpler than tetralogy of Fallot. One of the common defects that we deal with in babies, especially in premature babies, is something called a patent ductus arteriosus. So those two heart diseases are probably the most interesting parts of my field in terms of working in the cath lab, in terms of working in the congenital cath lab.
I know you already touched on this, but what exactly are the non-surgical interventions that you do when it comes to addressing heart defects? Like, how do you perform them and what do you use?
Yeah, so my job, as we touched on, is it uses catheters, so like these long, skinny straws that go in through essentially a big IV that goes into the leg. We watch where the catheter is inside of the heart by using X-rays, and so we work in a special lab that's got this X-ray equipment that lets us see what's going on inside of the heart. And some of the most exciting, some of the most interesting things that we're doing in terms of ways that we can fix things inside of the heart involve some of the things we just mentioned. So for like the little premature babies, we've over the past 4 or 5 years started using little teeny tiny devices that are called piccolo devices that allow us to operate on babies as small as 800 grams, so about 2 pounds. So those are the smallest things that we're working with. And also for like the bigger kids and for some of the adults, we've moved into also being able to replace valves in the heart without having to do surgery. And so we have 4 or 5 different valves that we're using these days. Mostly for kids who got tetralogy of Fallot, adults who've had tetralogy of Fallot, but sometimes for other types of heart lesions, or we can replace a valve inside of the heart without having to do surgery. And so some of the valves that we are using more recently that have just been developed and released to us over the past couple of years are things like Harmony valves, Altera stents, and then for the past 10 years, we've used valves like a Melody valve or a Sapien valve, which got a lot of experience. We've put in about 150 valves already. And it's a really interesting procedure. And for me, the procedure that seems to replace surgery most directly.
What is the most impactful part about your position as a pediatric cardiologist, or like what do you like the most?
Well, I really like being able to fix things inside of the heart. So there's all different types of doctors that help take care of people. And at one point I wanted to be a surgeon because surgeons use their hands to like fix things directly. It's a very satisfying experience to be able to fix stuff with your own hands.
Yes.
And what I do is kind of halfway in between being a surgeon and fixing stuff all the time versus being a medical doctor and kind of finding what the problem is. And so I get to do both parts of it. I really like doing the things that help save our patients from having to have surgery because we can fix pretty much all different types of heart disease with surgery. And now we're in the phase of taking care of congenital heart disease where we're looking at how do we do that more safely with less risk for the patient and with less recovery time for them.
Are you researching or looking for anything groundbreaking that may change your field? If so, what is it?
Golly, that's a good question because I actually don't know what's going to be different in the future. I mean, a lot of the stuff that is the most interesting parts, the most cutting edge things that we're doing now weren't even on the radar when I first started in medical school in terms of being able to replace valves inside of the heart. That's one of the most exciting things we do, and nobody was even thinking about doing that back when I was learning about medicine to begin with. I think that right now what we're involved in at my cath lab is evaluating these new things, these valves and these devices we're using for premature babies to see how well do they work? Are they better than what we used to do? One of the things that we're involved in my cath lab is that we're evaluating some of the things we talked about, those cutting edge sort of interventions, the valves and also the premature baby devices, to see how well are they working, are they better than what we used to do. And so we're actually involved in 3 different national randomized control trials that are looking at those devices to evaluate how well they work, so more outcomes-based things on the things that we already have, so that we can better design the next generation of things we're going to use.
And finally, what advice would you give to those seeking your field?
So pediatric cardiology and specifically interventional pediatric cardiology is this little tiny niche inside of medicine. Even within cardiology, inside of pediatrics, there's not a lot of people who do what I do. Probably maybe on the realm of like hundreds of doctors around the world who are trained to do this. And because it's so specialized, it takes a lot of education and a lot of training.
Yes.
I mean, we ran through my education. I was in 27th grade when I finished all the schooling that you need to get to be able to do what I do. So you really have to like school if you want to be a specialist like this. But yeah, I think that my field is a very exciting field to be in right now, because so much is changing, and I don't even know what the future is going to look like 10 years from now. And I think that as a scientist and as someone who likes taking care of people, I think that's just a very exciting thing to be looking into.
Okay. Well, thank you for interviewing with me.
Sure, my pleasure. Oh, you're gonna shake your hand.
I don't know. Sure. From this interview, I learned a great deal about non-surgical interventions against heart defects and being a pediatric cardiologist. For example, I never realized how much schooling is required to specialize in a field like Dr. Angtuaco's. At the end of the day, we hope that doctors like him continue to research for better groundbreaking ways to solve heart defects so that we can hopefully soon live in a world free from congenital heart disease and even heart disease overall. I would like to thank Dr. Angtuaco personally for allowing me to do this interview, and of course I hope you learned something from it as well. Thank you for watching.